It's not really healthcare, it's disease management. Health insurance is not health insurance, it's disease management insurance or disease insurance. And it seems to pay for anything that gets rid of the symptoms of the problem, whether it be a tumor mass or aching feet or headache or heart disease, rather than helping the body reverse that. I'm Dr. Robert Barnes, practicing complementary medicine with offices in Western New York. I was a general surgeon for 30 years, practicing general surgery as well as general medicine in a small town in Western New York. At that point, I have an older, wiser sister who gave me a book called 40-something Forever, which introduced chelation therapy and alternative or complementary type medicines to me. I call them health medicines at this point because before I was treating patients' symptoms to help them get rid of symptoms, where now I'm helping people regain their health. We have IV treatments. I give a lot of IV treatments in the form of Triox or ozone. I also give chelation intravenously, which helps take toxic heavy metals out of the body, allowing the cells to recover and to function better. And I give a lot of nutrients, vitamins and minerals, and a lot of vitamin C intravenously to help boost the body's immune system. Actually, my treatments are mostly to get toxins out of the body and get good nutrition into the body so the body can heal itself through the immune system in other ways that the good Lord dictated that we should do. One of the most important things at this point, as far as my practice, is to help people get an education themselves, or educating themselves to eat properly. Eating properly can reverse most disease processes, including heart disease. Eating properly can be many different things to many people. Somebody with chronic degenerative diseases, mostly we get the diseases because of toxins in the system and not getting the proper nutrition. So the cells, rather than function 100% the way they should, are maybe functioning 50% capacity. So as you give more nutrients, vitamins and minerals, in the form of foods or supplements, the cells start to function more toward 100%, thus correcting pathological processes that have developed over a lifetime, which could be 3 months, 3 years, 30 years, or 70 years. But all disease is reversible if you start on the right pathway to getting the cells to function properly through diet. Diet, it sometimes can mean taking a high protein diet, such as people who have autism and immune deficiency diseases along that line. The high protein diet seems to be a better functioning for them. Other people with heart disease, Dean Ornish showed that by eating lots of fruits and vegetables and no meat, that you could reverse heart disease. I saw an article in conventional literature that says heart disease is not reversible. People ask me why doesn't everybody use the treatments you use? If they're so good, everybody should be using them. And I usually answer that question with a question. If a standard treatment has so many adverse side effects and only treats the symptom of the disease, why would anybody use that? And of course, if this is standard medication at this point, or standard medicine, is that we treat symptoms only and we don't get down to the root of the problem. Thus, the disease process goes on while the symptoms get taken care of until the medication no longer works on them, or it destroys the kidneys, liver, and other organs of the body. Over the last few years, we've seen vitamin D in the newsletters and in newsprint. Vitamin D has been found to be a hormone and actually not a vitamin, but it's so important for our GI tract to absorb nutrients that go into the body and are used by the cells of the body to stay healthy. Without vitamin D, the villi of the small intestine can't absorb the nutrients that you're putting in by taking either supplements by mouth or taking organic foods that have the proper nutrition within them. Vitamin D is a compound that we've discovered that has very high prevention capabilities for cancer, heart disease, arthritis, just about any disease process we have. And it's basically because of its effect on the small intestine and the absorption of nutrition. The small bowel also consists of 80% of your immune system. The immune system in our body is there to help us stay healthy, ward off disease. It keeps pathogens, which are virus, bacteria, and fungus, at bay and kills off the pathogens in our body, and also helps us continue to be healthy. Back in the 40s, the vitamin D dosage was around 300,000 to 400,000 international units. I don't know why it got changed, but the authorities changed it back to only 100 international units to 400 would be necessary for us. At that level, by the end of the winter, Canadians are 98% lacking in vitamin D. And you don't want to be in the low normal range. The vitamin D normal levels are 30 to 100. When they do the testing on them, they say that 98% of them are below 30. Well, basically, we want to be in the 60 to 100 range, and if you happen to be 120 because you're a lifeguard outside all day long in the sun, that's not a bad thing. It's actually good for your immune system and good for your body. So vitamin D has become a very important nutrient for us to make sure that we consume, either through staying out in the sun a little longer or through nutrition, through the pills. You know, one of the other ways that vitamin D does help the body is the killer cells of the body, or the T cells of the body. It gives them a boost, and they thrive with vitamin D in the system, and they don't thrive without it, which means that the cells that protect us against disease processes are diminished if you don't have enough vitamin D. By the end of the winter, anybody that lives north of Atlanta, you're getting a very, very high percentage with vitamin D deficiencies. And I see a lot of people in my practice where normal is 30 to 100, they'll come in with a reading of 6 or 8. And as soon as you start giving them vitamin D, their backache can disappear, their energy level can come up. People with immune deficiency diseases, as you get the vitamin D levels in their body up to 60, 80, they start reversing chronic degenerative diseases. Yeah, for years we've been told by dermatologists to stay out of the sun because otherwise the cancer of the skin rate goes up. It's kind of strange because cancer of the skin rate is higher in the Northeast than it is in Florida. Vitamin D does not get absorbed if you have sunscreen on. So my suggestion is that you should go out and take some of the sun for 10, 20, 30 minutes a day, and then increase it as your skin turns a little on the tan side. Black people have 50% more chronic degenerative disease than people of light skin. And the biggest reason for that is that black skin people need more sunshine to raise their vitamin D levels up to normal. So because of they lack vitamin D, and we often find them at the 6, 8, or 10 range, their chances of getting chronic degenerative disease go up at least 50%. The medical establishment is now ordering vitamin D levels in higher numbers, but they're still not accepting the levels that are compatible with having a good high number. They've increased their thoughts of vitamin D from 100 and 400 international units to 1,000 and even 2,000. Some of the cancer institutes are suggesting 5,000 to 8,000 at this point, which is a good level. Most people will be very adequately supplied at that. However, sometimes we need to use 50,000 international units or 100,000 at a time to get the vitamin D level up for a month or two, and then go back to 5,000 or 10,000 to keep it at a good range. Chelation therapy is something that I first discovered about 17 years ago from a friend of mine who had been doing treatments of chelation therapy at his clinic for a number of years. When I visited his clinic and talked to patients, I was duly impressed on how people actually recovered from disease process, especially heart problems. At that point, I had a friend of mine who came over for dinner at Christmas time who was just sent home by Cleveland Clinic with about 2 to 3 months to live because he had had 2 bypass surgeries. He had, I think, 4 or 5 stents in place, and he was on about 6 different medications. I talked to him about what I had just learned about chelation, and he said, "You have to start me." He related to me the story he told about Cleveland Clinic sending him home. Well, to shorten a long story, we started him a week later on chelation treatments. That was 17 years ago. He was 63 years old. We had him for dinner this Christmas. Again, 17 years later, he's 80 years old and he still runs his own construction business and works 8 to 10 hours a day. So here's an example where chelation and heart disease is a reversible thing. It's a reversible disease. I've seen hundreds of patients with heart problems respond very well. I've seen people with arthritis, high blood pressure, other difficulties. As soon as you start taking toxins out of the body, you allow the cells to function better, and the body starts reversing disease. Chelation therapy, primary for most of us, deals with EDTA, ethyl diamine tetracetic acid. What it is, it's a synthetic protein that we give intravenously. We put it into the bloodstream, and basically what it is a negative, free negative ion going into your bloodstream that has to meet a positive ion to become a whole molecule. So as it finds this positive ion it likes, it grabs a hold of it and removes it from where it is. No longer acts in the body, becomes a whole molecule, and is excreted out of the kidneys over the next 24 hours. It removes mercury, lead, arsenic, cadmium. It also takes out magnesium and calcium. It takes out calcium especially not from the bones but from metastatic areas, areas where it shouldn't be. Arthritis is calcium in a joint where it shouldn't be. Plaque is calcium in the arteries in an area where it shouldn't be. So as it takes these ions out atom by atom, you start to reduce plaque, you start getting calcium out of the blood vessels as well as other areas of the body, and the body starts responding by going into a healing mode and reversing disease. We seem to be getting a lot more Alzheimer's disease these days compared to 50 years ago. One of the things that comes out with chelation is aluminum. Aluminum, people as they get dementia, as they get of higher age group, often will have loss of memory and repeating the same questions time after time. With chelation therapy, by taking toxic heavy metals out of the brain, which would mean that it will cross the blood-brain barrier at times, we get people reversing these thought processes and going back to normal. I had a secretary from my prior life, or my prior practice as I call my prior life, who repeated her husband's questions and asked the same question time after time. After 10 treatments, he came up and shook my hand and said, "Thank you. She hasn't asked me the same question twice in the last 2 weeks." So by taking toxins out of the body, the brain as well as other organs can revert back to a normal functioning as they did when they were more in a youthful state. Heavy metal is a very big problem, and it's getting worse. 300 years ago, we probably have about 1,000 times more lead in our system than we did 300 years ago, before we had the leaded gas and all the other things, the pipes and into our homes and that type of thing. Of course, dentists have been putting mercury amalgam fillings in our mouth for at least the last 100 years because they last very well. However, they spill out mercury into the system, which creates all types of mental as well as physical problems. Our air is becoming more and more polluted. As we know, the bears up in the Arctic have different heavy metals in their system, that, such as mercury, that comes in through the air, as well as the animals and fish that they get to hunt for. I've been doing chelation therapy for the last 17 or 18 years. About 7 or 8 years ago, I started using rectal suppositories in the evening along with an antibiotic to help the body recover and take out heavy metals. I haven't seen any hard evidence that the rectal chelation actually takes out more heavy metal. And I never did see the results that I would get with IV chelation. So I have to suspect that it's not as efficient, and I don't know the reason that it wouldn't be. But it doesn't seem to get the clinical results from the standpoint of reversing disease process that I noted before. When you're exposed to heavy metals, they're in the bloodstream for about 2 days. And after 2 days, they get tucked away in the tissue of the body. Now, if somebody had exposure to lead, let's say, and they had a high lead level in their blood, if we checked it a week later by testing the blood, the lead level would be within acceptable limits. So, which means that it drops down very low at that point. In order to get the proper reading of how much lead is in the system or other toxic heavy metals, we use the EDTA chelation and DMPS, which is another chelating agent, to latch on to the heavy metals and then draw them out through the urine, or expose them to the urine so they will come out in the urine. We can test a 6 to 8 hour urine sample for heavy metals and get a good idea of what is coming out of the body at that point, and thus what type of storage we have of heavy metals in the body. I've done the reports on times where people have been exposed at work, and my reaction in conventional medicine, well, of course, you got a lot of lead, mercury, and other things coming out. You use the chelating agent, but it's not in their blood. Well, it's not in their blood because God doesn't intend it to be in the blood very long. He intended to tuck it away in the body so it didn't create problems. So the only way of testing is really to give a chelating agent and then finding out what is coming out and in what ratio, and then testing infrequently to see how much less is coming out with time and treatment. The FDA comes into play here. The FDA approved chelation therapy 70 or 80 years ago, now that I think back, for the use in lead poisoning. It was used heavily in children at that time because of the lead paints and different things, and children are more, don't have the capacity to soak up the lead as well, so they get poisoned easier. It's a very safe treatment. It's 100 times safer than taking an aspirin a day, and the FDA has stated that. But they haven't given an approval for reversing heart disease or other disease processes. So the medical profession, because the pharmaceuticals haven't pushed it after the patent ran out on the medication, the pharmaceuticals can't make any real money on chelation where they can on heart disease and medications for other diseases. So it hasn't been exposed to the medical community as much as it should be. I've had people come in to relate to me that they talk to their doctor about chelation therapy, and the response is, don't do it, it's dangerous, or you can waste your money that way if you want to waste your money. If you don't want to waste your money, come in and I will help treat the symptoms of your heart disease for the next 20 or 30 years, and we will go forward with that. But basically, it's a negative feeling because we, as conventional physicians, which I was for 30 years, aren't exposed to the benefits or even that chelation therapy is an option for any type treatment. Oxidative treatments bring oxygen into the body, and there's a couple different oxygen treatments that can be utilized. One is hydrogen peroxide, which is H2O2, and when given properly intravenously will break down to H2O, which is water, and an O radical. The O radical is a free radical that kills off pathogens, virus, bacteria, fungus. Also, it helps boost the immune system, and interestingly enough, cancer doesn't live in oxygenated tissue. So oxygen can, by boosting the immune system, has so many benefits for any disease process we have. We can live, days without bread and water, but basically our cells can live 3 minutes without oxygen. So by bringing extra oxygen in your body, you're boosting the immune system, you're boosting the body's functioning right in the beginning. Now, ozone, or triox as I call it, is oxygen to the third power, and when you put that into the body, it's the safest treatment that I know of. I've given thousands and thousands of these without difficulties, without any side effects, just side benefits. But it has O2, it breaks down to O2 and the same oxygen radical. It also stimulates the body to produce an enzyme called 2,3-DPG, which allows the oxygen to come into the cellular area. So it takes the oxygen basically out of the red blood cell and into the cells themselves. So it's a very useful treatment, and probably the most beneficial treatment that I give is by bringing more oxygen into the body. Taking toxins out is very important, bringing nutrition in is very important, but as I said, we can only live 3 minutes without oxygen. Giving ozone, or giving the triox, as I mentioned, can be done in different ways. We can utilize rectal insufflation. We can put a catheter into the rectum, insert maybe 500 to 750 cc's of the ozone gas, remove the catheter, and the body will then absorb the ozone through the bowel wall into the bloodstream and right out into the cells of the body to kill off pathogens. We can also give ozone, which we do. We do give it rectal insufflation in the office, but mostly we give it intravenously. We tap a vein as we would at the bloodmobile, collect up to 150 cc's of blood in that bag, and then stop it, put ozone gas, which we collect in syringes from a machine that we have, into the bag, and we match the amount of blood that we have, usually 150 cc's. Shake that up, it turns a brighter red, and we give that back to the patient. It takes about a half hour to do, and as I said, it's not a dangerous procedure at all, and it's so beneficial to the body's immune system. Hydrogen peroxide is a different matter. We give hydrogen peroxide by putting hydrogen peroxide in a bag of 250 cc's of water and then give that intravenously. There again, a very safe procedure. When I first started doing this 17 years ago, I'd go to a meeting and there would be 50 to 100 physicians. Now at our meetings, I see more than 400 or 500 physicians. And this is just a small part of the physicians around the country doing chelation and other intravenous health treatments. In New York State, unfortunately, we don't have a lot of physicians. Probably 40 physicians in the whole state. In the state of Florida, in our registry, we have probably 200 physicians doing this type of treatment. Now, not all these, there are many more physicians doing that, but they're not in the organization that I'm associated with, which is the American College for Advancement of Medicine. So there are getting to be more and more physicians doing this type of procedure because we want to see our patients become healthy, not just get rid of symptoms. The insurance, you know, we say that in fact, we're in a program now for healthcare in the United States. It's not really healthcare, it's disease management. And healthcare or health insurance is not health insurance, it's disease management insurance or disease insurance. And it seems to pay for anything that gets rid of the symptoms of the problem, whether it be a tumor mass or aching feet or headache or heart disease, rather than helping the body reverse that. So most insurances do not pay. Out in the state of Washington, if you are insuring health care, and you really are insuring health care because it can be used for naturopaths and other people who do chelation and other treatments, as well as for your conventional doctor that treats the symptoms of disease processes. It's strange because in Western Pennsylvania, chelation is paid for routinely by Blue Cross and Blue Shield. In Western New York, they don't pay for anybody for chelation therapy. So most of the services for the doctors that are doing alternative health care do not get paid for. You know, as if I go along further and further in this, I'm just astonished at what I see and how people recover their health and disease processes that are when they come in for treatments, and they have treatments of chelation, ozone, hydrogen peroxide, and vitamins and minerals, the reversal of disease and the alleviation of symptoms that I see. I was in practice with my brother and my nephew at the time that I left, and both of them didn't want to know anything about chelation or what I was doing. After 2 years in practice, my brother had a heart problem for which he did chelation and reversed his heart disease very nicely, but my nephew still wasn't accepting to that because we have been brainwashed into this, and I know that I was that way for 30 years, so I'm not astonished that other doctors don't look at it. It's going to take young people finding out about health, which we're getting more information all the time. Even some of it on television is positive for health. And it'll take the young people to learn this, and then the older doctors to die off before we find a reversal in our healthcare system. Right now, our healthcare system is breaking the bank, and it's not helping us stay healthier. We're a nation that spends the most money, by far double any other nation per capita, on quote, healthcare, and we're 48th on the list of healthy countries. In order for us to have optimum health for ourselves, it's what we do for ourselves. It's not what anybody else can do for us. And the best thing that you can do is to read some books on health. There are a couple excellent ones. One is put out by a ditzy blonde, as she was called for years, by the name of Suzanne Sumners, who's really a brilliant female, who has produced a number of books, but her latest one, which I think is an excellent book on cancer, is called Knockout by Suzanne Summers. She reviews 7 or 8 doctors who are treating cancer with non-toxic preparations. There's also a book called Wellness Against All Odds by Sherry Rogers, MD. It's an excellent book about health and what you need to do for yourself to get yourself into a healthy state. And you can read and reread that book multiple times and learn so much about diet, exercise, and all the other things that bring us into good health. There's so many things with foods that are against us. The high fructose corn syrups and all that they say don't throw up your blood sugars, but are killers to us. MSG in the foods that increase the salt intake that we have. Now, salt itself is not a bad thing, but as you get variations of salt such as the MSG, it's not natural to our bodies, and it's put in just to enhance our taste buds so that we will eat more, which most of us don't really need to do. There's countries around the world that promote health more than others. I used to think that Germany and some of the European countries were probably more into good health than most. But I think right at this point, Cuba and Russia are probably 2 countries where they do more natural things. And they do that because they're poorer countries that are using natural modes, especially a lot of ozone treatments and other natural things to treat and prevent chronic degenerative diseases such as cancer, heart disease, and arthritis. Germany still, the pharmaceuticals are trying to get in there to limit nutrition throughout Europe. They're trying to get it so that you can't have a vitamin C pill more than 50 milligrams because vitamin C is so important for our body. And they don't want the body to get high doses or adequate doses of things that would be good for it. In order for us to have optimum health for ourselves, it's what we do for ourselves. It's not what anybody else can do for us. And the best thing that you can do is to read some books on health.